Hi, and welcome to How Humans Heal. I'm Dr. Donnie Wilson, and in this episode and this video, I'm going to be talking about how to understand your PAP and colposcopy results. In particular, if and when you have results that show an abnormality, I want to help you to understand what that means on your results and what your options are. So, just so you know a little bit about me, I am a naturopathic doctor and midwife. So essentially, working in holistic gynecology or women's health. And I have specialized in helping women with high risk HPV virus and abnormal pap smears for over 25 years. So that means that I've seen so many different possible scenarios and cases of women of all different ages and backgrounds, including all different locations around the world. And because I've had that much experience with high risk HPV virus and abnormal test results, and I also have put my attention and intention into helping women to prevent cervical cancer, vaginal cancer, and other forms of HPV related cancer. So that's been my focus, and that's been where I do my research and my clinical work. And so I have developed a protocol that has been successfully helping women to clear high risk HPV virus all the way to negative and be able to maintain at a negative and therefore prevent the virus from causing cancer. So if you found this video, I'm glad you're here. Welcome. I know you likely feel very alone and afraid and even in shock of that you even got these results. And the fact is that now more and more women are finding out that they test positive for high risk HPV and potentially abnormal cells. And that's for several different reasons. One is now more than ever, gynecologists are testing for high risk HPV virus. In decades before, we didn't test for high risk HPV unless we saw abnormal cells. But now the tides are changing and we're testing for high risk HPV first, and definitely when women come in for a physical exam or gynecological exam. Now, another thing that happened is during the pandemic, a lot of women didn't go to the gynecologist, and even the gynecology offices were closed. So there was a period of time, even a couple years long, where women were not getting their gyne exams as regularly. And then when women did go to a gyne exam with the gynecologist, then they went to test, and sometimes then the virus was able to progress to abnormal cells during that time period. And so it can be quite shocking. That's one of the scenarios that I hear about. I also hear about women who just didn't know that they should be going in for a pap smear and HPV test. Maybe you just haven't been sexually active, and so you thought, I don't need to go. Or maybe you had a hysterectomy and you were misinformed to think that you don't need to be tested. Or maybe you thought since you're over 50 or something like that you thought, oh, I don't need to go in. And yet, yes, I want to emphasize it is important, even if you have been not sexually active for a long time or had very little sexual exposure, or even if you had hysterectomy, it's still important to be tested for high risk HPV virus on a regular basis. And right now, the guidelines, if you've had normal negative test results, you might even go 3 to 5 years between high risk HPV tests. But if you've had a positive test or you've had ever any abnormality in the past, you're going to want to be tested more often. And I would say, and this is not in the standard guidelines, but if Dr. Donnie Wilson could add to the standard guidelines, I would say, if you know you've been under significant stress, if you know you went through the pandemic, for example, that's all of us. If you've been through a divorce, a stressful job, working night shifts, having a newborn or multiple children, this is a high level of stress. And that's when women's bodies get depleted, when we're under a high level of stress. Maybe it's death of a loved one or taking care of your loved ones for numerous years and not having a chance to take good care of yourself. These are all some of the scenarios I see when women end up testing positive for abnormal cells. So I want to let you know that if you know you're under a lot of stress, that's when you want to be paying attention and getting tested for high risk HPV and abnormal cells, because with my protocol and from my perspective, it's better to take action as soon as you find out that there's an issue. Now, in a standard medical system, you might be tested for high risk HPV, and when you do go to the doctor's office, and you would get a pap smear, and if they show no abnormal cells or mildly abnormal cells, they might just say, come back, just wait and see if it gets worse, come back in 6 months or a year. And I'm here to say, from my experience, I would not wait. I would definitely say, as soon as you know you're testing positive for high-risk HPV virus, as soon as you know there's even mildly abnormal cells, I would start following my protocol, because I see women turn that around all the time. Sometimes within 2 to 3 months, sometimes it takes 6 to 12 months, but I see women being able to reverse those mildly abnormal cells and get HPV to negative and prevent it from progressing, which is a way better way to do this if we can catch it early. So if you're listening and you have low-grade cells, then it's time to take action. Or if you have high-risk HPV and you don't have any abnormal cells, it's time to take action. And for those of you where it has progressed to CIN 2 or 3, and I'm going to be talking through what all that means here in a minute. If it has already progressed to CIN 2 or 3, please know that I can also help. There are still options. There are still ways to help your body to heal. And I would definitely want to be able to meet with you and guide you through that and help you with it and see if that's a good match, if you're a good match for my protocol. And at the very least, even when it's progressed to CIN 2, 3, even if it has progressed to a carcinoma in situ or cancer cells, and you're having to address the cancer cells, I would still suggest that you follow my Dr. Donnie's HPV protocol to address the virus. Because the fact is that even if you have a LEEP procedure or a surgery like a hysterectomy, even if you had to do chemotherapy, it's not necessarily going to kill the virus. Most cases, the virus remains even after those treatments. And so the problem is that the virus can cause a recurrence of the abnormal cells. And so that's why it's so important in my mind to look at this as a two-step approach, 2 prongs here. We can't just only pay attention to abnormal cells and deal with the abnormal cells. Yes, that's important. We want to identify abnormal cells and address them. But that's not the end of the story. We have to start addressing the virus, high-risk HPV virus. And there are absolutely effective ways to address high-risk HPV and clear it to negative and keep it negative. So please know that if you're catching this video and you know you're testing positive for high-risk HPV, no matter what type of cells you're dealing with, please consider following my HPV protocol to help your body clear HPV to negative and prevent it from progressing and prevent it from recurring. Okay, so let's understand your results a little better. By the way, if you're wanting to find more about my protocol and how I help, you can go to my website, which is at drdonnie.com, just DOCTORDONI.com. You can also go to clearhpvnow.com, and you're going to see all kinds of videos from me, videos from women who've worked with me, as well as articles and more free resources that you can download, including the HPV recovery guide, and you can sign up for the live How to Get Rid of HPV workshop, where I guide you to understand exactly how I think about this, how to understand the current research, and how you can start creating a plan to help you to completely resolve high-risk HPV and get this out of your body and out of your life for good. Okay, so now that you know how to get more information, I want to go into some more specifics about the test results. So if you don't have your test results and you just only got a phone call from the doctor's office, I encourage you to contact the doctor's office and ask for your test results. Ask for your Pap and colposcopy and HPV results. I believe everyone should have a copy of their test results so you can save them in a folder, whether that's on your computer or in your file cabinet, so that you know what's going on with your body. So I definitely encourage you to contact the doctor's office and get a copy of your results. And what you're going to be looking for on your test results is, first of all, did they get an adequate sample? It should say, when you get a pap smear, it should say adequate sample. So if it doesn't show adequate sample, then they're going to need to repeat it. And then the second thing is, we want to see if they see the endocervical cells. So if you think about the cervix, you have the main part of the cervix here that looks like a I call it a pink donut. And when you see the opening inside the cervix, this is called the endocervical canal. So when we take a sample, we're looking for abnormal cells. We're looking for cells around the face of the cervix and right inside the opening of the cervix. So when you see that there's adequate cells and there's endocervical cells present, the next thing that you're going to look for on your results is, are there any abnormal cells, right? So the third thing is any abnormal cells. Now, there may be some different medical terminology on there. What you're going to look for is, we hopefully want to see no dysplasia. Dysplasia means abnormal cells. So when we say no dysplasia, that means no abnormal cells. Or it might actually use the word benign, B-E-N-I-G-N. Benign means healthy cells. So we want to have benign epithelial cells or benign squamous epithelial cells. Or it could say no dysplasia. So those are all good things. That's what we want to see. Now, when it comes to abnormal cells, there's various different terminology that could be used. And it depends on the lab, because each lab uses a little bit different terminology. So the best way to break it down and to think about it is that the abnormal cells are either going to be considered low grade or high grade, right? If you think about it and you think about the virus it goes into the cell. I say it hijacks the cell. It goes into the DNA of the cell, in the nucleus of the cell, and it starts changing the DNA. So it starts changing the way the cell looks, right? If you change the DNA, the cell's going to look different, including the way it looks around the nucleus of the cell is going to look different. So they can see this under a microscope. So when the pathologist looks at your cells under a microscope, they can see how do the cells look, the shape and the coloring or absence of color around the nucleus of the cell. So if the virus is only mildly active, it's going to cause low-grade abnormality. And as the virus is more active, it can cause more moderate to severe abnormality in the cells, right? So you want to understand that it's a spectrum. It's not just a yes or no. It's really, is it a little bit, or a medium, or a lot of effect on the cells? And so that's what the pathologist is looking at, and that's how they're describing it on your test results. If it's normal, it's going to say normal, no dysplasia, negative for intraepithelial lesion. And malignancy. That's how you know it's no abnormal cells. That's what we want. We want negative normal cells, normal epithelial cells. If it starts to be a little bit inflamed cells, because at first HPV can cause the cells to look inflamed, and that can also be caused by other things, like even yeast and BV can do that, or low vaginal estrogen can do that. And on the pap smear, that tends to be called atypical squamous cells of undetermined significance. Undetermined significance, meaning it's not quite too low grade or high grade. It's still very mildly abnormal. And I would say the best way to think about it is that those cells are inflamed. And so atypical squamous cells of undetermined significance, we use the acronym ASCUS, right? ASCUS. And so ASCUS is a mild inflammation it might be caused by HPV, but it might be caused by something else. And so we have to investigate and we have to see, is the HPV positive, in which case it's quite likely caused by the HPV. And that's at the cancers way over here on this end of the spectrum, and the ascus is way over next to normal cells, right? That's like, sometimes we see ascus when the cervix is also healing. It goes through ascus before it's completely healed. So then if it progresses from ascus, then it's going to go into the low grade category. And the low grade could also be referred to as CIN1. So you might see low grade like LG, or you might see CIN1, and that's the same thing. It's just different terminology. CIN1 stands for cervical intraepithelial neoplasia grade 1. And that just means that the epithelial cells have some abnormality that's mild. And that could also, they might also use the word koilocytosis, which starts with a K, koilocytosis, which means that the cells they look like they've been affected by HPV. And that causes there to be a clearing around the nucleus. So when they see that, they call that koilocytosis, and that's an indication that HPV is present and active.
Ladies, high-risk HPV virus doesn't have to control your life. I'm Dr. Donnie, and I've been at the forefront of women's health for over 20 years. I've helped thousands of women to clear HPV naturally with my proven protocol. And this isn't about just managing the virus, it's about eliminating it for good. Join my workshop and take control of your health and your body with an expert guide by your side. Click the button below.
Okay, so that would be CIN1. With CIN1, from the standard guidelines in gynecology, it doesn't require a surgery or procedure to remove the CIN1, because in many cases, CIN1 could resolve on its own, and it's at low grade, right? It's not anywhere near cancer cells yet. And so the standard approach right now is to say, okay, CIN1, let's just wait and see if it gets worse. Now, from my perspective, when I see CIN1, I want to take action, because I'd rather take action before. I'd rather help you avoid the need for a procedure or a surgery, right? And so if we take action when it's no abnormal cells or ascus or CIN1, and we can help your body heal, we can prevent the need for any kind of procedure, surgery, or other type of treatment. So I say, let's start working now. Why not get motivated and turn this around? I can very effectively do that over and over again using diet approaches, nutrients, herbs, and balancing your body, whatever's out of balance, whether that's blood sugar, or hormones or microbiome. I help guide you through addressing 8 susceptibilities to help you clear high-risk HPV. Okay, so now if you see on your results that it says CIN2 or CIN3, or sometimes it might say both, it might say high-grade dysplasia, right? CIN2, CIN3 is the same as high grade. Both CIN1, both CIN2 and CIN3 are high grade types of dysplasia. Okay, so if it's CIN2 or 3, that's considered high grade. And the difference is now you're in a category where in gynecology, an procedure or surgery is indicated, right? So as soon as it goes into a high grade category, which is either CIN2 or 3, that means we should take action to remove those abnormal cells. And that's the standard of care currently that I see around the world. So that's what that means. If your results say CIN2, 3, I know you're going to be bummed about that. You're going to be disappointed. Likely you're going to be angry too, because you're going to think to yourself, well, I wish my doctor would have told me that I could have done something to prevent this. And I get it. There's a lot of anger, frustration, resentment, sometimes guilt, and shame, and all of that to process. Sadness, disappointment, all of that. We're going to process all the emotions while we're looking at these results and say, okay, try to take a breath, try to be gentle with yourself. It's not your fault. This is not your fault. Most times you don't hear or learn any of this anywhere in the medical system, so you wouldn't have known. And being exposed to high-risk HPV is very common. Most all of us are exposed by age 50, and it's very common to test positive for high-risk HPV. It's very common to develop abnormal cells. So this is not like you did something wrong. You were just being human, and you got exposed to a very common virus, and then you got depleted by stress. And this is what happens. So sometimes you just have to take a few days and breathe and think to yourself, okay, this is my reality now. This happened to me. This is occurring, even though you have no symptoms that you know of related to HPV, right? HPV doesn't cause a discharge or an odor or a pain. And so likely you had no idea this was going on. And so it's quite a shock. So you want to just give yourself a chance to go, okay, this is not what I expected. And yet now it's really here. That's why I think it also helps to look at your results, understand your results, understand the guidelines, and say, okay, here's the reality. If you're at high-grade cells, we definitely need to take action now, because we don't want it to progress another step up, and it's going into carcinoma in situ and carcinoma. And if it gets to that point, then likely you're going to be looking at needing to do cancer treatment. You're going to need to work with an oncologist. You're going to need to think about chemo, radiation, other cancer treatments, potentially a surgery. That's going to be more decisions to make, right? So if we can prevent that, that's going to be better. So start to get your head in this and go, okay, CIN2-3, what am I going to do? Because I don't want it to progress to carcinoma in situ or cancer. If it does progress to carcinoma in situ or cancer, I help with those cases too. You work with your gynecologist and you work with your oncologist, and they help with those abnormal cells. And then I help you with the HPV. So yes, I help with those cases as well. I also help when there's abnormal cells in the vagina, on the vulva, in the anal area, in the oral area. My protocol to address HPV is going to work no matter where we're talking about in your body, but the most common is when you have an abnormal pap. And what will happen is, if your pap shows abnormal cells, likely your doctor is going to recommend that they do a colposcopy. A colposcopy is a biopsy of the cervix. And when they do a colposcopy, if you're going into the doctor's office and they're doing a speculum, but they can also see more clearly than a pap smear. With a pap smear, we're just taking a rough sample from the whole face of the cervix and the endocervical canal. But when we do a colposcopy, we can more specifically see where the abnormalities likely are and specifically take a sample from those areas. And so when we see the results of a colposcopy, it's considered to be more accurate than a pap smear. And so that's why your doctor is likely to recommend a colposcopy. If you have an abnormal pap result, they're going to recommend a colposcopy to get the specific information before they do a treatment. Because say your colposcopy shows that actually the cells are not high grade, maybe the colposcopy says the cells are low grade, then they're likely to go by what the colposcopy says, and they're going to say, okay, wait and see. And so that means you have more time to address it with my protocol and prevent it from progressing. If the colposcopy also shows and confirms high-grade cells such as CIN2 or CIN3, that just is the same thing, cervical intraepithelial neoplasia, grade 2 or 3, and it's based on how your cells look under the microscope. And a pathologist can then say specifically, and they might say 2 or 3, or they might say some areas are 2 and other areas are 3, right? So it could be a combination of 2 and 3, but they don't know, often they don't know exactly how much area it's covering and how deep it is into the tissue. So that's why then your doctor's going to likely talk to you about different possible treatments. If they think that it's superficial and they can clearly see your cervix and you haven't had any other treatments, they're likely to recommend what's called in the US a LEAP procedure. And so a LEAP procedure allows them to remove the abnormal cells without removing part of your cervix. And it's called a loop electrosurgical excision procedure, a LEEP. It's similar in other countries like the UK, but they use the word, they call it a LETS procedure, but similar type of electrosurgical excision. So they can remove the abnormal cells. It can cause some scar tissue, but it doesn't remove part of your cervix. Now, the next procedure they might consider, which is a little bit more invasive, is called a cold knife cone biopsy or conization procedure, where they do remove part of the cervix. And it's a little bit more advanced procedure that's used when we think the cells are more widespread and deeper, and potentially if you've previously had a LEEP and now the cells came back again, they might recommend doing a cold knife cone biopsy. Okay, and then if it's depending on your age and how many times this has recurred and the severity, they might recommend a hysterectomy. A hysterectomy removes the whole cervix and the uterus, right? The cervix and the uterus are connected to each other. So if they remove the cervix and the uterus, then they're going to be preventing the abnormal cells from spreading into the uterus. The thing is that then there doesn't necessarily remove the virus, and the virus can still cause abnormal cells vaginally. So that's why I would say, even if you do any of these procedures, a LEEP, a cold knife cone, or a hysterectomy, you're still going to need to address the virus and make sure it doesn't cause this to happen again, or else you might be in a repeat situation of having to go through this over and over again. And I know some of you are in that. Some women I've talked to have been dealing with this and have had many biopsies and many procedures and even surgeries for years, if not decades of their life. And so I see you, I hear you, I understand what you're going through, and I want to help you get it to stop happening. There are ways. I help women who've been dealing with this for decades to finally be able to put a stop to this virus and prevent the need for more procedures and surgeries and treatments. So if you're in that situation, I welcome you to reach out. You can contact my office. You can set up a time with my team. They can help you to schedule an initial consultation with me. And this way I can understand your case and help you to create a really comprehensive plan. Because to me, I'm not going to just take this lightly. I'm not going to just take this as, oh, okay, let's just do a couple little things. Let's just do a little mushroom extract, or let's just do a little green tea. No, because I know better. I've seen the worst of the worst cases, and I know what it takes to stop this virus. And I know it's possible, but I also know that we have to take it seriously, and we need to prioritize you right now. No more procrastinating, no more delaying, no more putting everything else ahead of yourself. It's time to put yourself at the top of the list and ask for help and say, hey, I need help. I don't want this virus to take over my body and my life. I want to be in charge, and I want help, and I deserve help to change this and to stop this from happening, because that's not going to be the approach in the standard medical office. The standard medical office, they're going to give you treatment for the abnormal cells and then just recheck you to see if it happens again. So I want you to know that if you have, no matter what your results say, if there's abnormal cells or not, if those abnormal cells are mild, low grade, high grade, or beyond, I can help you. So what we would do is, when there's my standard protocol, which I would work for all types of HPV, even no matter if you have, this is the other thing on your test results, is that on your test results, it should show you some amount of, sometimes it just says high grade HPV, sometimes it says specifically 16 or 18, which are the 16 and 18 are the two types of high risk HPV that are most associated with cancer risk. But that's not the only types. There's actually 14 types of HPV that are associated with cancer risk. So 16 and 18 are only two. So there's 12 others that it could be. And some labs will list all 12, and some of them will just say other. So it might say other type of HPV, or it might say 16 or 18 or both. So it's going to tell you some degree of what type of high-risk HPV is testing positive, hopefully, and it will also help you to understand. It doesn't test for low grade types, by the way, and it's not going to give you a specific number. I wish it would say, oh, from 0 to 100, but it doesn't. It only says positive or negative, or it'll say detected or not detected. And these are based on highly sensitive PCR, mRNA, or DNA analysis of the virus. So this is actually testing for the DNA of the virus. This is not an antibody test. Like sometimes when we test for other viruses, we test antibodies. For HPV, we are actually testing for the actual virus based on its DNA. And so if it shows detected, it's present. If it shows not detected, it's not present. And so that's how we know when the virus has cleared. When it says not detected and negative means it's not there anymore. Okay, so you're also going to see that on your test result. And my protocol helps with all the different types of high-risk HPV. It also helps with low-risk HPV, and it helps with HPV no matter where it's located in your body. Again, mostly we're talking about the vaginal area. So I want you to know that there are ways to help, and my team and my office is here to help, and I'm training more practitioners in my protocol so that there can be more practitioners available to help you with this protocol, because I believe women deserve to have help to address abnormal pap smears and prevent cervical cancer, vaginal cancer, and other types of cancer caused by high-risk HPV virus. So you are no longer alone. You don't have to deal with this alone. You don't have to be in the dark. You don't have to be navigating this with a bunch of question marks, because we know what's working. So all you have to do is just contact my office or sign up for my group program, and I can guide you through the protocol step by step with a group of other women who are on the same path. So you're no longer feeling alone, and you're no longer feeling confused, because you're going to know exactly what to do. So that's what we're doing over here in my office and in my practice, and I'd be happy to help you too. So I'll put down below links so you can contact us and get more information and learn more. But I want you to understand that if you have no abnormal cells, or if you have ascus, or if you have low grade like CIN1, that means that we have the best time in your situation to help prevent it from getting worse. And we're going to start using my protocol, which includes diet and nutrition, nutrients, herbs, homeopathic remedies, as well as vaginal suppositories and probiotics in a very specific dosing, high quality professional grade products, and I guide you through it every step of the way. And this is how I'm helping women reverse low grade cells. Now, if you're in the category of high grade cells, CIN2-3, we're going to want to sit down and have a conversation and say, okay, it's now high grade. We don't want to waste time. We don't want that virus to have the chance to go into cancer. So we have to take action immediately, and we need to address those abnormal cells. The best case scenario is you're going to choose either to do a procedure with your gynecologist's office, or you're going to talk to me about doing escharotic treatments. Escharotic treatments is a traditional herbal natural treatment to the cervix to remove abnormal cells without a medical procedure, without any risk of scar tissue or damage to your cervix. So this is often chosen as a way for women who want to preserve their cervix health and their uterine health for future pregnancy. It also can be used for women who are postmenopausal. But it's really important to consider your case and whether escharotic treatments is going to be the right choice for you. Again, it's not used for CIN1. It's used for CIN2 or 3. It's not used for carcinoma in situ, and it's not used for cancer. It's only used in those high-grade types. So if you're CIN2 or 3, that's when you could consider escharotic treatments as an alternative to a LEEP procedure. Okay, so if you'd like to learn more, definitely reach out to my office so I can look at your results and help you understand if that's an option for you. If you eat, no matter what you choose, if you choose to do escharotics or you choose to do a LEEP or conization, then we have to still take action to address the virus. And so we're going to still use my protocol including the diet changes, the nutrients, the herbs, the homeopathic remedies, and microbiome balancing, and addressing all 8 susceptibilities to HPV so that we can make sure your body clears it and prevents it from coming back again. And that includes my proprietary formulas and proprietary suppositories. So you can access all of that through my website, through my office at drdonnie.com. It's Dr. Donnie Wilson, and you can read more there on the website, watch videos, and read all kinds of testimonials from women who've worked with me over the years, so you know this is not something new. This is not just the first time doing this. This is something I've been doing a long time, and I'm here to help. I want you to know it's available to you, and then you get to choose what's right for you. What are you going to choose for your health? What are you going to choose at this moment in time? And believe me, I know it's scary. It feels very vulnerable. It feels vulnerable to talk about this sometimes with other people in your life, whether that's your partner, your friend, or whoever. It can be vulnerable to talk about this with another practitioner. It can feel very scary, and I know your mind might be very hard on you right now. So I want you to know I understand that, and I'm here to be supportive of you when you take that courageous step to say, I know how scary it is to reach out. I'm going to do it anyway, right? Because you deserve it. You deserve to have help, and I know it doesn't exist. I'm trained to work in a standard gynecology office. I'm trained to do pap smears and gynecology care. That's my training and my licensing, and I could be doing that, and I was doing that for many years, and then I realized, hey, wait a minute, women are not getting enough help with abnormal cells and preventing it from progressing. And that's when I decided to create this type of practice where I can help you to prevent progression, and I can help you to prevent it from recurring. So if that's what you're looking for, now you know how to find me. I'm glad you're here, and I welcome you to subscribe to How Humans Heal and join me here. If you're watching on the YouTube channel, subscribe so you don't miss my next video, or to subscribe to my newsletter so that you'll receive my newsletter each week, and then I will share each new video and interview. So I look forward to connecting with you soon, and I'm glad you found me.
Thanks for listening to How Humans Heal. If you liked this episode, leave a rating and a review. And for more resources, visit drdonnie.com.